China could possibly be bracing for the COVID-19 crisis once again, as the nation is recorded a surge in the active cases of the COVID-19 cases since the month of April, after which experts have predicted that by late June, up to 65 million people in a week may be affected with COVID in China. Now, this observation comes at a time when a top scientist from China, who's a former director of China's Center for Disease Control and Protection, has said that the lab leak theory for the origins of COVID-19 should not be discounted. It is important to note that China is grappling with a new wave of COVID infections after abandoning virtually all pandemic control restrictions in December. Remember, China also implemented the zero COVID policy for 3 years, of which led to widespread protests and panic buying in Shanghai. So will we see imposition of strict lockdowns once again? And for how long can China really deny this lab leak theory? We have with us China strategist from Hong Kong, Andrew Kepiling, who's joining us on the broadcast. Andrew, always a pleasure speaking to you. Thank you so much for taking our time and joining us. Firstly, I want to understand, you must have spoken to a lot of people over the last couple of weeks. What are they telling you? What is the situation pertaining to COVID in China currently?
Of course, there is a resurgence of infections, not only on the Chinese mainland, but in some other cities, including Hong Kong, for example. But these cases are pretty mild. And then the fatality rate has gone down dramatically to the extent that the previous health warning has been downgraded. Both on the mainland in Hong Kong and elsewhere around the world, including the World Health Organization. So this latest resurgence of a new virus suggests that the virus is migrating to a possibly a continuing infectious variant, but much less deadly, and also because of the much higher vaccination rate of people in China, in Hong Kong, and elsewhere. So this is nothing alarming. 65 million is only 5%. 5% of China's population a week is no different from a common cold.
But Andrew, 65 million might just be 5% of China's population. But if you see the worldwide trend where COVID cases are almost down to zero in many of the states and countries. So that's why this number is alarming. And the other question is, what are the measures that the administration is really wanting to take? Because if you go back to the previous waves, that zero COVID policy that the China administration adopted had earned a lot of criticism. And the kind of scenes that we saw by the end of it were gut-wrenching, to be honest.
Well, I think China's imposed a very strict lockdown, succeeding in hugely reducing the spread of the virus in China, or deadly virus in China, resulting in a very low death rate, according to the latest data recorded by Johns Hopkins University. If you look at the Johns Hopkins University, which of course is a world-renowned institution in the United States, you can see that the death rate recorded there, both of China and India, are very, very low, compared with the death rate in the United States, over 1 million dead. More dead in the United States because of the virus, because of the COVID virus, than the total number of deaths of soldiers in not only the Second World War and the First World War combined. So, you've got to put things in a bit of perspective.
I also want to understand, what do you make of another scientist now coming out and saying that for how long can China really deny the origins as far as COVID-19 are concerned? Another scientist has now come forward, spoken about the lab leak theory. Can China really deny the origins as far as the virus is concerned?
There seems to be a revival of the lab conspiracy theory. Not only, this latest suggested, as you reported, by the Chinese scientists, but also the so-called vaccine doubters in the United States and elsewhere, saying that, well, all this is an engineered virus coming from a lab, and in order to, as they're in collusion with the big pharma companies and so on and so forth. And as far as the lab leak theory is concerned, there is also a theory that, in fact, the lab leak virus was brought into China. Because shortly before the outbreak in Wuhan, there was a military exercise, and soldiers from the United States in this exercise and mysteriously sort of repatriated to the United States. And also the Fort Detrick in Maryland, the United States, is the biggest virus lab in the world, established shortly after the Second World War. And even then, there was a kind of expansion of the lab a few months before the Wuhan outbreak. So all sorts of conspiracy theories, but still the majority of scientists around the world, including those in the World Health Organization and Western countries, most of them do agree that lab leak theory is nothing more than a conspiracy theory.
Andrew, what I essentially also want to understand, the reason why this is becoming worrying with each passing day is that why is China unable to contain the pandemic or the spread of the COVID-19 virus? And I said, at a time when other countries have had a very good grip, we haven't seen a resurgence anywhere else, their vaccination has worked, other measures have worked. Why is it so difficult for China to get a grip as far as the spread of the virus is concerned?
Well, when the outbreak was first reported in Wuhan, no one in the world knew what it was, including the scientists in China. But China very quickly, in spite of an initial hiccup because of low-level officialdom, quickly shared the data found in this newfound virus internationally with the Lancet, the world's renowned medical journal, and shared the DNA worldwide. It's just that the Western countries, particularly the United States under Donald Trump, didn't take these data seriously and thought that the whole thing could blow over in a couple of months. And of course, Donald Trump later on even said that you could use detergents to kill the virus. Things like that led to a very high death rate in the United States. As far as China is concerned, as I said, the death rate has kept extremely low because China has one of the most highest congested population, all centered in the coastal provinces. So it's very easy to spread, and hence this very draconian lockdown, which succeeded in lowering the spread of the virus inside China.
But how was this draconian lockdown a success, Andrew? And that really is the question that many continue to ask. As I said, go back to the images and pictures that we saw of people wanting to jump from their buildings because they were locked up inside their houses without food, without essentials. So will the China administration at least now accept that the zero COVID policy was misthought of?
I think that initially, when there was a lockdown, a lot of the people in China all supported their government. But I think 3 years was a very, very long time. And as I said, it is because the Chinese population concentrated in very large cities and very easy to spread. And hence the length of the lockdown led to some initial frustration. But the frustration led later on to a greater understanding among the Chinese people. And after some initial hiccup, I think most of the people in China really thought that the government has done an excellent job. 1.4 billion people with such low infection rate. As I said, a lot of the people concentrated in large cities. And even though, of course, that some people remain at first was not happy with the lockdown situation. But overall, the result has been very positive, especially after China's now opened up very quickly and things are returning to normal.
Okay. Andrew, lastly, I wanted to understand, with this resurgence that we are seeing, what are going to be the immediate steps as far as the administration is concerned to try and contain these numbers and to also ensure that the severity doesn't increase?
Well, these numbers, even though you don't believe the numbers in China, you've got to believe that world-renowned institutions like the Johns Hopkins University, which is unlikely just to take data fed to them unchecked. And according to the website, you can see that both the infection rate at the end has been extremely low by the international comparison tables. America and some other Western countries right on top, and countries China and along with India, very, very low. It's only single digits compared with very, very high digits. As I said, 1 million people, more than the people killed in the First and Second World War combined
Okay,
in the
Andrew.
United States.
Okay, Andrew, we'll have to leave that conversation there. Appreciate you joining us for this discussion.